Hi, I'm Lynette Reddington. You have joined the CHIP reveal, or the Community Health Improvement Plan reveal, for our 2023-26 plan. We have not done one of these before, so we're gonna zip through this and give a bunch of detail for you. We will have this available for your viewing very soon, as well as this is being recorded. So we'll have this recording as well out and available soon. Let's check and make sure, if you're not muted, if you would mute yourself. We do have the chat going and we have staff monitoring that. Alini and Lori are here with me in the room, so they're going to pop over and be presenting once in a while. But I'm going to just jump in and share my screen. We just had a little bit of issues there, but I know it's going to work perfect this time, right? It's going to work perfect. There it is, working perfect. Yay! So if you do have questions, please use the chat box. That would be great. And here we are for the reveal. So very exciting. We're going to see if at least it's going to move forward on me now. All right, guys. There we go. All right. So just a recap for some folks, because I know some of our stakeholders have been with us through this entire process and others have not, but I wanted to ensure that everybody remembers what we're doing and why we're doing it. We have been creating the Community Health Needs Assessment Report. We started this process with this core team of individuals back in October of 2022. All of these representatives are from agencies have been with us. And one of our new ones this year that you see is Communities Organizing to Promote Equity. That is our KU project, and we have community health workers. So we're very excited to have them join us this year. And we also have officially the Blue Cross Blue Shield of Kansas Pathways for a Healthy Kansas. That is part of our Healthy Harvey Coalition and funding for that. So we're very appreciative of that private foundation being part of us as well. So going to move to our next one. Little bit again, probably folks who've seen it. It's the slide that tells you what we've been doing since October. We set a timeline. We completed a survey. We did that in January and December. We had all that survey input come in and the quantitative data collected. We had a great intern, Amanda from KU, getting her master's in public health, that assisted with us greatly. We gathered up the surveys, both online and in paper format. And then we had 7 total focus groups, which was fantastic. We got all that data together, and I should, again, kudos to a lot of people, Amanda being one of our biggest ones. And then that report is getting finalized as we get done today. We had our stakeholder meeting. We had 3 of them. Stakeholders, as well as the core team, helped us determine what those priorities for health are for the next 3 years and how we can make changes in those. And we are documenting all of that. We are going to be announcing the current Community Health Improvement Plan results. That would be from 2020 to 2023. And we're going to promote our new priorities and the new CHIP that we're going over a bit today. So the priorities we have for 2023 and 2026, in no particular order, are these: the social and economic growth. You can see right there some of the areas that this were indicators of this particular priority. So we have employment, housing, instability, and poverty were the key indicators. We have chronic diseases. The key indicators: prevalent chronic diseases such as diabetes and heart disease, et cetera, hypertension. We have birth outcomes in family planning. This is a new area. This one includes our low birth weights, prenatal care, and our sexually transmitted infection rates. Our last one is our mental health and behavioral health services. Areas such as depression and substance misuse were indicators from our data and the perceptions. So 3 of these, the social and economic growth, I should say, has got expanded. It used to be just economic. So now we're doing social and economic growth, and it's a large area. But we're going to dig into these a little bit more on each of the goals that you'll see for the CHIP. So I'll just keep on moving. let's get to this chip reveal. So want to just give you a little layout of how each of the goals look so that you can get familiar with it. And then we'll hand this over for Lori to start with her area. So the layout of each goal, it has the title of what the priority is, the health priority. This one happens to be social and economic growth. The goal area is poverty. And then we did a SMARTY goal, and that would be by June 2023, because that's, excuse me, I should say June 2026. We have the wrong year. We've already found a mistake, but we'll get that corrected. There will be an increase of the proportion of people with health insurance. So you will see that in 3 years, again, June 2026, we hope to have this accomplished. You see what the highlighted of the HP 2030, then those code 8HS-01, that is the Healthy People 2030. We are looking at that as a national CDC and Health and Human Services project that they run. And so we are using that as our guide, because then we have some measures across the USA that we can be consistent with. Also will help greatly when we're looking for funding for some of our projects as well. So then you see the next part is a baseline. So they went and found some information, and our data source for Kansas happens to be for this one, Kansas Health Matters. So we have a data source. And so the baseline right now is 89.4%. The target for 2026 will be 91%. And the Healthy People 2030 actually has a target of 92.4%. So we wanted to kind of just show what the nation target is. You know, maybe we're at it, maybe we're below it, maybe there isn't actually a Healthy People 2030 target, but we wanted to ensure that we had some guidance here for everybody as you're doing it and be as consistent as possible. And then the CHIP 2030, which is the one we're finishing up, we started it in 2020 and we're ending it in June 2023. So that actually didn't have this particular goal, so we put not applicable. But we wanted to, again, have most of these are looking exactly like this for every goal that you see and each of the SMARTY goals. So that is one. The next portion of our goal is the strategies, action steps, and outputs. So today we're going to go over strategies and action steps. The outputs are all those things that we need to do or we expect to have come out of these action steps. So we're not going to go deep diving into that today, but that will be available for you to review. And the strategies are policy changes, system changes, and environmental changes. Some of us are very familiar with the PSE. This is something that everyone has been going to on particularly education and health and many other arenas, because just doing an informational program, yes, it can be helpful, but we want to see deeper dive and a deeper change in behaviors and attitudes and even structures. So policy changes are just as you hear is like putting in a policy. I'm going to throw out an example of, we just talked about this the other day, is that an employer has a breastfeeding policy. Employee has a child they'd like to bring to work, and so they have this opportunity to have a child at work. That would be one policy. The other one would be possibly having breaks to go for breastfeeding or pumping in that case. So that's a policy change within an agency or an organization. A system change based on that could be, and so I didn't think of this through when I started the example. System change could be the environment with your staff, and having those staff be supportive, and also signing up to say, I'm going to assist the mom if she needs something with the child, and perhaps she has to go to another, go to an appointment or something of that nature within her office, and another staffer could help in. The next is an environmental change, which be basically I could have a breastfeeding room, and there is a huge environmental change because I've got a space just designated for that purpose in regards to helping out that particular employee. So just a little bit of that. And again, those were the type of action steps. So crosswalking is actually when you have our action steps and they're actually affecting another goal. So there may be something particularly in poverty that we might want to link with behavioral health or mental health. So we'll have some notes there, as you'll see as you go through. And then previous work might be work that has happened in the past. Perhaps it was a agency or a coalition or partners have been working on this particular topic of poverty. I know my brain says I would put Peace Connections on there and the work they're doing with Circle of Hope. So that's the previous work. And then you see lead agency and organization. So that doesn't mean we all get off the hook because we identified a lead agency or organization. That basically is for, as we go through the years of this plan, we will be accountable to that agency to say, how's it going? Have you progressed? Where's your 6-month mark, your 1-year mark, your 1.5 year? How's it going? Are we getting through the action steps? Are we feeling like things are happening? So it does take all of us in Harvey County to focus on these and find the passion, the one that works for you, and join in, and we'll be able to get this done. So just know, lead agency doesn't mean they do all the work, but they do help to make sure it keeps moving along through the years. Then is going to be our next steps, and I'm just going to do that right now so we can get that done and jump into our plan. So next steps are, right now we're completing the current CHIP, right? That was 2020 to 2023. We're going to finish up that report. We're also getting our community health needs assessment report completed right now for this new 3 years. And then in July, all of this is going to start beginning, and we're going to promote the old results from the old CHIP that we are just wrapping up, and we're going to be promoting the new CHIP and what we have found. And that promoting looks like going to civic groups, going to the commissioners, cities, county, just to say we've worked on this, we've identified these health priorities, and we're going to need some assistance and your support as we go through this. So that is a little bit of a nutshell. Let me pop out of my stop sharing and bring us over to Lori in just a minute. Let me find my CHIP reveal and say, yeah, it's going to look right. All right, Lori, it looks correct. Okay, and move it on up.
Okay, so starting off with social and economic growth, as Lynette said, there is no particular order. This is just how they lined up on the paper. So our first one is housing. We have a lot of goals we're looking at. A lot of it has to do with supporting renters and owners, making sure that we have housing that is affordable for people and people are not spending more than 30% of their income, and please not more than 50% of their income on housing. And looking also at maintenance for people, making sure people's houses, they've got them set up so that if they end up in a wheelchair, they can get into their house, they can use their house, they can stay in their home. So maintaining homes, and other things with maintenance, but also then support for renters. So all of that, sorry, while I scroll down, our action steps, we've got them divided, all of our action steps that are policies, and then the systems that go along with it, and then the environmental stuff that goes along with it. So our first one is looking at rental units, making sure that rental units are inhabitable in each municipality and throughout the county. And we don't know what this is going to look like yet, because we don't know what is possible yet. Collaborating with the planning and municipal zoning to make sure that we have housing that is under 30% of the annual income. So making sure that all the houses that are being built are not $500,000 homes, but there are homes that are possible for people to purchase at a lower income. And then this is the big one, creating a Harvey County Housing Coalition. The model we're looking at is the model that is being used in McPherson County right at the moment for the Housing Coalition, that works, one, to support cities and communities, but also to support people maintaining their houses. The systems changes we're looking at are things that support people being able to purchase houses. to get equity in homes. So like Frameworks is a class. They've changed the name. I do not know what the new name is yet. I can't remember. I probably do know, but I can't remember. This is a class that is taught online free of charge by Fannie Mae in order to teach people how to save money for houses, and then also what it's like to get a mortgage. A brush up program, which, sorry about that, I went one screen too far. A brush up program is helping people who cannot physically maintain their houses do annual maintenance on the houses. So it could be painting, it could be building a ramp, it could be hauling off brush in the yard. Building awareness of renters' rights. This has been a problem over the past year, 2 years. At least it's come to my attention in the past couple of years, with renters not knowing what their rights are in regards to maintenance of their property or their units, and maintenance, or not maintenance, but what's the word when you get kicked out? Eviction. Eviction, how the eviction process works. Basic home maintenance education. New owners don't always know what they need to do on housing. Like how do you maintain, how do you put in a new filter in your furnace? So offering classes like that. And then again, connecting the agencies that actually can support people to the people, which is a big part of what the community health workers do. People come to the community health workers, say, hey, I'm having trouble with this. They help them find the agencies and services that are available. And then environmental changes is creating a program to make changes on houses, to make sure they're ADA compliant, to make sure the houses have 0 entries so that they don't have to go up steps to get into a house. Lots of crosswalk, lots of previous work. The lead agency on all of this will be the New Housing Coalition. If anyone's got any questions, type them into the chat. Everyone's monitoring it in the room right at the moment. So, all right, moving on. We're going to zoom through these, by the way, because there's a lot, especially in this category. Childcare. Yes, we know about all of the childcare issues in the county. We are aware, we're working on it. We're aware about the current and updated news too. So yeah, we are looking at creating policies and practices that will make it easier for people to become childcare providers if they want to. So scholarships for all the training that they have to go through, scholarships for if they need to make it, if they're going to be a home-based center and they need a new fence put in their house, things like that. We're looking at how we can get it support for them that way. We're looking at creating a system so we can track things at a state and federal level that are going to affect us at a local level, so that we can be prepared. Systems changes, again, we really want to know, what do we need? What do we need for parents? What shifts do we need coverage for? Do we need emergency coverage for someone, their provider is sick and can't take their kids that week? Where do they take their kids? And then also, what barriers are there to local providers becoming licensed and staying in the field? What are the problems they're facing so that we can support them, so that we still have providers. We don't have providers leaving the industry and moving on to other industries. Looking at, again, hiring a person that we can help providers find what resources they need, and also help people who are interested in becoming childcare providers, walking them through the process. And then also working with employers to help their employees with the resources that are available. There's tax credits that are available, all sorts of things that can help businesses, employees afford childcare, because childcare is very expensive. And then create a marketing campaign to promote the assistance that's available. So those are our strategies. A lot of people are working on this. There is actually a leadership team that was created back in January that is working on this. It's part of the Newton Public-Private Partnership, the Chamber, Harvey County ICC, a bunch of other people that are already involved in this. Okay, again, if you've got questions, type them in the chat and let us know. Or concerns, I should say. But transportation, we've had this one before. We have it again. When we divided the transportation on this one, the group that was working on transportation, we divided it into public transportation. So actually having to have an automobile to get somewhere. And then also multimodal, we call it, which is a fancy word for biking, walking, taking a skateboard, a scooter, a wheelchair, whatever, to get where you need to go. So a lot of this work will be building on what we've already got and expanding it. Oops, sorry, I scrolled too far again. So working with the Department on Aging, which is the county agency that houses our public transportation services. I know a lot of people, I will say it once again, I say it every single time, it is not age dependent. It's for everyone. Prices are based on your income and how much money you make and what services are available, but it is for all ages, not just those over 65. All right, increasing bike-friendly businesses, which is actually a program. I won't take the time to explain it right now. If you want more information on it, give me a call or just Google bike-friendly communities, League of American Bicyclists. Bicycle-friendly businesses, bicycle-friendly colleges or universities, and bicycle-friendly communities. We're looking at expanding all of those. What those are is signs that where you live is supportive of people using bicycle for transportation, and it's common to see people on bicycles. When it's common to see people using the roads on their bicycles, you are less likely to have accidents because people know how to drive and ride around each other. Maintaining sidewalks, been a hot button topic lately. Maintaining sidewalks in communities, making sure people are trained when they're learning how to drive a car on how you drive around people on bicycles, but also making sure people, especially the elementary and middle school age people, learn how to safely ride your bicycle on a city street or a low county street. And then we're looking into the feasibility of bike share programs for Newton and North Newton. That's a costly one. We don't know where it's going to go, but we have to figure it out. Expansion of public transportation services. Again, this is just the system change that matches that policy change above. One of the other systems changes we're looking at is randomly we can get helmets and locks to give out to especially elementary and middle school age. And it's random. We don't know when we're going to get the funding for it. So we're trying to find a stable source of funding to be able to consistently give out free helmets and locks to people who are getting bicycles. Again, Confident City Cycling. It is a program that educates people on how to ride safely on streets that will also have automobiles on them. And then the creating regularly scheduled activities. Again, that just builds people out walking and biking. It builds the normality of it so that people are more used to seeing people walking and biking, which at least in Newton, we have a lot of people that walk, but not quite as many that bike. So trying to build that to make it a normal thing. And increasing bike parking. One of the things we are often asked is, where can I park my bike downtown? This is why we do bike valet at all of the big city events so that people can park their bikes safely, because we do not have enough actual bike parking spots downtown. Recycle is a program that Etc. Shop already does to an extent, which is taking bikes that have been abandoned or people have donated, fixing them up and either selling them at a lower price or giving them to people like who've had their bike stolen or who need a bike to get to work or to the grocery store. Environmental changes, we've been working on this for a long time, but just increasing them. These are actually making our community easier and safer for people to walk and bike and roll. So wheelchair, skateboard, scooters, whatever. Again, these have been worked on for a long time, so there's a lot of previous work and there are a lot of partners on it. Okay, we're moving on to the next one. So if you have questions or concerns about transportation, type it into the chat for me. Oh, is that one for the transportation? All of them? I'll go back to who all was partners on this one in a second. Because there were a lot of people that worked on this category, a lot. Employment. So when we started this, Lynette was saying that our big key goals, their key measurements were housing, employment, and poverty. And the reason we have more than housing, employment, and poverty in this section, even though those are our key goals, is we decided that the other things that apply to employment, housing, and poverty also needed to have their own categories, like the childcare and the transportation. And we'll get to food insecurity in a minute. So that's why, even though we have 3 key goals, we have 6 action plans. So employment. This was focusing on supporting people in employment. Not necessarily, to an extent, supporting, like bringing in people to hire other people. But mostly we looked at how do we support people to maintain their jobs. So our policy changes we are looking at is expanding curriculum at the high school, middle school, and college, and the tech to include skills like how do you interview for a job? How do you do a resume? How do you fill out an application? Expanding programs that already exist. Keep going, 1 page too many, I'm sorry. Expanding programs that already exist, like the Greater Wichita YMCA, which the Newton YMCA is part of, has a program that is a job prep program through the YMCA for younger people. But then there's also a program that helps older folks who are retraining for a new job. So say you're 50 and your business just closed and you need retrained to go out and find another job, it helps you with that. Again, expanding these are the systems changes that go with those policies we just talked about. Expanding the training in high school, middle school, tech, college. One of the things that was a big discussion was expanding the education for emotional intelligence and regulation in younger ages so that they know how to work with other people in older when they get into the workforce. Expanding resources at libraries. And again, our environmental changes that go along with this are, this is the one that actually applies to recruiting businesses, to open businesses in the town. Several years back, you may have been part of our Economic Development Council when they hosted a study by Garner, I believe was the name of the company. And one of the things that they said that we needed, Harvey County needed to recruit businesses to open here is improving our quality of life. So why would people want to live in Harvey County? So that is this, it's improving things in our community, such as outdoor recreation, dining, entertainment, all of that, so that people really want to come to Harvey County and stay. Again, lots of partners on this one. A lot of work has been done on this in the past. It's going to be continued because there's a lot of work to do. All right, next one is food insecurity. I'm going to go through this one really quick because if anyone has heard us talk about our food system plan and our strategic plan for the Harvey County Food and Farm Council, that's what this is. It's being done anyway. Food insecurity was brought up as this is something that needs to be worked on to support families especially those in poverty, trying to get out of poverty, supporting employees, and helping students learn. So we really just sort of copied the strategy over from our food system plan for the Food and Farm Council. So I've been talking, Lynette's been talking about this. You've probably heard multiple people talk about this plan for the past 6 months to a year. So I'm not going over it too much. It is broke down into categories of increasing access to food. That is being able to afford it, being able to get safety net food. So food pantries, the pantry at the porch, all of those type things, supporting those. Also, though, it is how do you physically get to food? So you don't have a car, or you only have one car in the family. That car is currently at work with a spouse. How do you get to the grocery store when you need to feed the kids? So it's physically getting to food and being able to afford food. So food access. The other category is education, and that also is broken down into 2 categories of increasing education for youth about food. So how do we get food? Where does wheat come from? Where does your bread come from? How does it get from a wheat field into a grocery store? But then also, how do you educate people on working in food systems? So it's a multi-category. And then we have also in there economics. So how do we grow our economic of supporting local producers that are growing food to be sold in our local stores or our farmers market? So it's multiple categories. There are multiple projects that are policy and a systems part of it, and an environmental change, focusing on a bunch of different things that are already going on. I'm not going, like I said, I'm not going to dig into it too much because it's really very in-depth, and you've probably heard us talk about it multiple times. If you want me to go into it, someone yell out really quick and I will actually physically read it out. But otherwise, I'm not going to read through that because we have limited time. Going once, going twice. Okay, we're moving on. Poverty. This is the last one of this section. A lot of this was looking at how do we support people who are currently living in poverty and how we support them building their skills to get out of poverty. But then also, how do we work with youth so they, how do we prevent them from falling into poverty? So several of our measurements are to deal with 4th grade reading and math levels, and also truancy at school. So there's that. Policies that have been recommended is making sure that whenever we host simulations or bridges out of poverty trainings, that the elected officials and city and county hired employees are invited to attend those. This is to help build awareness of what it is actually like to live in poverty and to get rid of some of the stigma that's associated with it. Promoting insurance options for those without insurance through their employers. So building the base of our employers that can provide insurance to their employees. Availability of small and short, there I go, moving one page too fast. Small and short-term loans from reputable financial institutions, such as banks and credit unions, as opposed to the short-term loans that have extremely high interest rates and really just force people to stay in poverty. Policy changes include also creating a system of training, a collaboration between financial institutions, banks, credit unions, and schools and agencies that provide education to people, so we can build the financial literacy of our residents. Again, have the community health workers in this one. Building in places where the community health workers are housed to help people get services. One of the things community health workers, I think, occasionally throws people off, and they think that they are strictly to help people find doctors. It's not. It's everything that impacts health, which is everything we've been just talking about in this section. So your housing, your income, all of that. So they are a lot more than just helping a person find a doctor. Expansion of therapists and counselors in schools, and supporting a truancy prevention program in at least one of our school districts. Currently, we do not have that. Again, the systems changes that go with those poverty or the policies, the poverty simulations, the bridges out of poverty, making sure that we have those at regular scheduled times. Expanding our collaboration with United Way to promote reading promotion programs. We already have the Dolly Parton Library through United Way, and if you ever heard our former United Way director speak, then you know that third grade reading levels is how we measure how large our jail needs to be for our incarcerated population. So this is a big one, expanding reading at our young levels. And then also making sure that people can actually physically get to financial services. A lot of our banks are on the outskirts of town, so it's a little harder to get to them. So making sure that our banks, our credit unions are actually accessible for people who do not have a car. Again, crosswalking with transportation right there. Okay, so that is all of this. I believe that's all. Hang on, let me double check. Yeah, that is all of my section. Who all worked on this? There was a group of stakeholders working on this plan that included the community health workers. It included the Ministerial Alliance of at least Newton's, but also some that are in some of the other ministerial alliances. It included the Chamber of Commerce. It included Economic Development. Peace Connections was part of this. Department of Transportation was on this planning committee. I'm missing several people, but there was a very broad group of about, I think there were 9 of us working on this one. And we contacted a lot of people that were not there physically to ask their opinions on stuff. So it was a very broad group of people working on this. Were there any other questions about who worked with us on this one?
No.
Yes, it is still on the radar. Actually, if you get the new Kansas bike map that should be coming out very soon from the state of Kansas, you'll notice that it is listed as a possible future trail on that plan. So it is still being discussed. It is still being worked on. And if you really want to talk more about it, contact me, because we have opportunities for people to help us spread the word. So I won't not go into my promotions at this point. But if there's nothing else, I will pass it over to Alini, and she will go on to the chronic disease part of this. Rotation time.
Okay. So I will start with who worked with us. Matt Schmidt and Alyssa Durham from Health Ministries Clinic. Sandra Leatherman and Heather Porter from NMC Health. Jennifer Zucker from the K-State Research and Extension, and Tasha Vila from Kansas Christian Home. And we also asked input from several people, and hopefully it's reflected on this. And if it isn't, we will take feedback and improve our plan. We chose 3 topics. One of them is diabetes. We are trying to decrease the hospital admission, and our action steps for it are increase the number of employers who use incentives to promote employees' health, partner with schools, they're in their wellness committee. Let me see. Develop and implement a community health resource guide. So once a person gets a diagnosis, we want to make sure that they are aware of what's available. And then we want to make sure that we know everything that's available and all of our providers know, so that things can be used appropriately. Increase the proportion of people with diabetes who get formal diabetes education, including trying to find someone that speaks Spanish instead of using translators. Increase the opportunity for physical activity, increase free exercise opportunities. So one of them is to promote, for example, people using bikes, but then the other one is offering exercise opportunities within our community that people can just gather. We want to provide diabetes screening regardless of medical care access. And that is because we know that sometimes people don't go to the doctor's office, and when they go, it's a little too late. So we want to make sure that we are reaching them before it's too late. We want to increase healthy food access to, again, diminish diabetes in our community. For cancer screenings, that's our second topic. We want to create a community-wide wellness task force to see what is being done and what can be done. And that includes the free screenings from the state. Sorry, I went too fast. We want to make sure that we can integrate cancer screenings into primary health care, and we want to do screenings outside of the primary health care settings. I'm hearing some feedback. And then we also want to assess and add indicated cancer screenings through in school activities, but also for college-aged people too. We want to promote opportunities for pre-cancer screenings through June of 2026, and again, try to consider having Spanish communication and Spanish speakers to help that population. And we are trying to see if we can do screenings outside of the primary healthcare settings. So maybe try to see if we can do it at the grocery store where people already are. And then we want to make sure that the communication, again, whether it's within the healthcare establishments or outside, that we're making sure that we're having them in English and Spanish. And for cardiac disease, our goal is to decrease the proportion of adults with diagnosed hypertension by improving access to blood pressure checks and referring them to existing resources. We know that this has been done before, but maybe it's been a little dormant, and we want to revive or broadcast better we want to know who are the employers that already have wellness incentives, and we want to promote them and make sure we are supporting them and finding out gaps. And then once we know who they are, we can see who is not doing that, but would be willing to do that and support them. We want to develop policies to integrate blood pressure checks in at work, school, maybe church and community events. We want to develop policies that introduce partnering organizations to, again, resource guide, so that once they have that diagnosis, that they know what they can do, what's available to them. We want to improve the proportion of adult stroke and heart attack survivors to participate in rehab services. We want to develop educational opportunities regarding healthy food options, healthy steps, and weight management. And we want to expand and communicate free exercise offerings that enhance health. And basically what we are trying to do is reach people outside of the healthcare settings and make sure that we reach as many people, even those that are afraid to go to the doctor, whether that's because of money or repercussions. And now, if there are no questions, I will invite Lynette back. Thank you.
How exciting. You're getting to see all of our faces over here and hear our voices. So a lot of information has been put out there for you. Now, the next priority, health priority, is birth outcomes. I have my notes over here, and family planning. So we did divide it between birth outcomes and family planning as two separate groups to focus on. I will tell you a little bit about the team. We had Melissa Meyer from the Kansas Children's Service League, who does the Healthy Families here in our county. Johnny Brown with USD 373 Newton with Special Education Cooperative, works very closely with the infant toddler team. Christy Schoen with the Kids Network, that is the Kansas Infant Death and SIDS Network. Annie Pitts with K-State Research and Extension with Youth Development and 4-H. And Chris Allen, who is our KU COPE, one of our KU COPE community health workers, and myself. And as the other folks mentioned, we did reach out to many other experts in the field as we have been developing. Particularly, you will also see we have NMC Health that we have tapped to do a few things with us and help us out. And want to reiterate that these teams are not meeting on and on and on. It's going to be partnerships for us across the county to be able to implement these things. So it's not as if that team is it, but I'm sure they will be partners in some of the work here because it is some related to much of the work that we do. So the goal for our birth outcomes is to prevent pregnancy complications and maternal deaths and improve women's health before, during, and after pregnancy. So by June 2026, we hope to increase, we'll increase the proportion of pregnant women who receive early and adequate prenatal care as identified by the Adequacy of Prenatal Care Utilization Measure. You'll see the baseline right now is 48.5%. Being realistic over 3 years, we are hoping for our target to be 53%. Of our births. Again, this is of women receiving early and adequate prenatal care. So we are a bit far away from the Healthy People 2030 target, but we're gonna just keep on moving and get us some action here. So our first initial policy change in this area is that we looked at the Kansas Department of Health and Environment Maternal and Child Health Purpose, and that is to make policy additions and or adaptations that improve the health and well-being of moms, infants, children, and youth, including those with special health care needs and their families. So with that, we're going to investigate some funding opportunities and possibly go ahead and go forward with them. And that would be a large grant from Kansas Department of Health and Environment offered to us called the Title V. So because we know it's going to take dollars to get some of this work done. So our system change, sorry, we're all going to say sorry, is establish an accountability system of the prenatal and the postnatal care. I mean, we have a lot of people doing a lot of things, and we really don't have the whole scope put together. So we are looking at providers who go into homes. We're looking at providers who do this work in clinics. We're looking at our providers who are working at the community health worker sites that those folks are at, where maybe there's virtual options that we're going to be building on, and maybe they're already happening. So we're really going to be doing a lot of investigating in that first year, and then moving into ensuring everybody's aware of it and how referral processes are working, and move forward with that, with the system change. Next, which these are all the ways we're doing that with the outputs. So I'm going to keep moving. Oh, and we did note a lot of the previous work that we have, previous meaning action happening right now as well. But one of the areas is an active infant transition team. And that was pre-COVID. We recognize that that group maybe hasn't congealed back together too much since then. So that would be helping them move forward to also get further work going again, like they were. So, and that things happen, right? So our second goal under birth outcomes is reducing the rate of infant deaths within 1 year of age from 9.2 to 8.0. This is that infant mortality rate that you hear often about. We were really focusing in on low birth weight babies, but the data from Healthy People 2030 was not there. So we decided we better go with infant mortality. We have dug into that data. We will dig further into that data for us specifically in Harvey County. But in this instance, for our goal, we did look at that as our rate. So right now our baseline is 9.2 per thousand. We want to get to 8.0. We've got to start somewhere. So we're going to try to get at least to 8.0 in the 3 years. Healthy People 2030 want us to get to 5. So we'll just keep on moving. We'll just start and keep on moving. So the first portion that you see there is a policy change. And this is talking with all of our providers who are working in family and pediatric and obstetrics, OBGYNs, let me say OBGYNs, that they would adapt policies to support safe sleep, breastfeeding, tobacco cessation, mental health care, substance use, interconception care, that is spacing out babies' births, and then pregnancy intention, people actually thinking about when they want to have a baby and preparing themselves for that. So this goes from everything from doing an inventory, what's happening right now, what are these providers doing, as well as going to increase education on, maternal warning signs and perinatal mental health, many of the things I just mentioned. So we have some big plans in this one, and we do engage our community health workers quite a bit. So we're excited about that. So it's going to pop, just going to warn you. Oh, I'm good. Okay. Our next portion is a systems change, and we want to engage more of our mental health partners in a maternal mental health training. There is training out there for certified perinatal mental health providers, and we're very excited about that. And I understand that Prairie View has actually already looked into this program, so it may be something that won't be so difficult for us to get going. And so that is exciting to know about. But it was definitely something our team said, hey, we need to look into this and ensure that folks are aware of it. So again, things that are already happening, our Breastfeeding Coalition is working very hard. There are a lot of these partners that are working together to ensure that this education is out there. But we want to make sure that, again, we know the scope of what is being done, and make sure nothing's dropping through, because we really do want to help these moms and our babies, so to have success. So heading on to family planning. There it is. Our goal for family planning is to improve pregnancy planning and prevent unintended pregnancies. So by June 2026, We want to increase the proportion of adolescents who receive formal instruction on delaying sex, birth control methods, HIV, AIDS prevention, and sexually transmitted disease before they were 18 years old. So we want to increase the number of kids who are getting this education. Again, we use the Healthy People 2030 wording, so that's why it does say sexually transmitted disease versus sexually transmitted infections. So with this one, our system change, we wanted to look at really what is the formal education right now being given to our kiddos, adolescents, pre-adolescents, what's happening. And so the best place for us to go is find out what the schools are doing. And we started that search. So right now we don't have the full baseline, but that's one of our first things we're going to do in the short term, is to find out what's happening. Do want to give a shout out to the Kansas Learning Center for Health in Halstead. They've done a great job of working with the Heston and the Halstead schools to ensure that those students are receiving all of that education. So we have some figures there, but we haven't heard from our other districts. And so we're checking out on that to see what's actually being done right now and when kids are receiving this information and education. So we kept it to that because, again, we want it to be very doable. And K-State Research Extension said Annie said that she would take hold of making sure that this work keeps on moving. Our last of our family planning and birth outcomes. Our goal for family planning is to reduce the proportion of pregnancies conceived within 18 months of a previous birth by 10%. So again, it's understanding the bodies and recovering from pregnancies, that really having at least 18 months between pregnancies is to be encouraged. So we're looking at and want to engage our agencies and partners about pregnancy intention and asking questions. One of our largest partners here will be NMC Health, because they'll be able to give us some data with their informatics groups that they have to help us get a baseline. Because right now that was not available for us, though there is a target for Healthy People 2030. They did that often through a survey, and it's not available to us on the local level. So NMC Health is going to be able to help us out finding some information on that. And so we hope to, again, get out there with our agencies just to say, hey, have you thought about when you're going to have another baby? Are you interested in another baby? Those kind of things, and ensuring that the partners all out there are asking that, or who is asking that. Again, some of those survey things for us to really find out what's happening. So I'm going to pass this over to Rachel with Mirror. And she is going to talk about our behavioral health, mental health section. So Rachel, come on.
Hi, everyone. My name is Rachel Ingledow. I am the STAND coordinator with Mirror. For anyone in here that's not familiar, STAND is a student-led initiative through Mirror. We're in Harvey County, and we also have Peabody, and it's really the kids focusing on reducing mental health, reducing substance use, boosting mental health, and spreading positivity among peers. So the substance use section under behavioral health, STAND is already doing a lot of work within the schools. The kids are doing a lot of peer-to-peer messaging. So for this goal, we're just looking to continue the work that the kids are doing and then build in some more of the mental health aspect. So by June 2026, we're hoping to reduce the current tobacco use of adolescents, increase the proportion of children and adolescents who show resilience to challenges and stress, and then to increase the proportion of adolescents who think substance abuse is risky. And so these statistics that we have down here, these baselines, we pulled those from the KCTC, which is the Kansas Communities That Care Survey. The depression baseline is pretty high. There's mental health is really something that a lot of teens and middle school age students are struggling with. And so, it's a little bit of a lofty goal, even to just reduce it by that, about 3%. But we're feeling good about it. We're going to do our best. And then also just reducing those suicide attempts, that 10.8 to 9.5. that number is a little stark as well, once you really think about the number of students that is compared to how many take the survey. And then also just continuing to reduce our 30-day use of vapes, alcohol, and marijuana. Those have been consistently going down every year. So we're just want to continue that work and see those numbers continue to trend down. And then also looking at the risk of harm for vaping, alcohol, and marijuana. The number of kids that see those behaviors as not being harmful has also been trending downward. So we'd like to continue to see that happen as well. Okay, and so then I'm going to pull up my notes really quick. So for this first action step, we're going to be incorporating just talking with students a little bit more and educating them on how to identify those mental health symptoms. We're really giving the students the education to be able to do that. With our mental health messaging in the past, a lot of it has focused more on building in those protective factors for students. So talking with them about what healthy outlets are, and really making sure that they have access to those things that are those protective factors, talking to them about connection, the importance of having conversations. But we also want to make sure that we hit the other side of that and educate students on what are the things that you need to look for in yourself or your friends or your peers that might be concerning behaviors or symptoms, or you may need to speak with someone else or get in touch with those other mental health resources. So really coupling those two things where we're like really including boosting those protective factors while also mitigating those risk protectors for the kids. And so moving into like the short term for 6 months to a year, we'll be engaging high school students in creating effective middle school prevention and mental health messaging. So this kind of goes into already STAND has partnerships with all of our middle schools and does prevention education with the middle school age students. And so really leaning into that. So we're not just providing that mental health messaging to our high school students. We're also getting to those kids a little bit earlier and starting in, 7th, 8th grade, sometimes even 6th grade, continuing to build that in. I believe in Newton, we usually do 8th grade. We're working on expanding that to 7th grade going forward. And then our other schools, we cover 7th and 8th grade, and sometimes even 6th grade for some of our smaller Harvey County schools. So looking at building that messaging in for those younger students as well. And then let's see. So for intermediate, again, continuing to incorporate those youth-led tools. So the beauty of what STAND does is that everything is student-led. So we really, it's one thing for us to get up in front of the kids and try to educate them on these things. It's another thing for us to have a high school student that's able to do that. So really what we're doing is educating our leaders to be able to then share that information with their peers. And so each year we're really looking to grow that and continue to build in more messaging so that, as we move on in this 3-year cycle, the first year they'll get some messaging, the second year they get a little bit more, the third year they're getting a little bit more, so that as they get older and grow up, they kind of have more of a cohesive understanding what's important in terms of the negative impacts of substance use. They have built in those protective factors, working on boosting their mental health as well, and know what their resources are. Let's see. I'm just going to skim through my notes really quick. I think that's pretty much everything that we have for STAND. So if anyone has questions, you're welcome to reach out to me. So shoot me a message if anyone has questions.
Great. Yeah, stick it in the chat as well if anyone has some questions there for Rachel or for, the birth outcomes and family planning. Totally kind of skipped asking for any questions, but you're probably knew that by now. All right, we're going to have Jody join us from Prairie View. She has got the other section, and Jody might be springing this on you, but could you tell us also what team members or stakeholders were a part of your planning group here?
We had several. We had Tobias from the health department. We had Mike Yoder from the police department, Ben from MIR, and there were a couple other people, but I'm blanking out right now. But we had kind of a input from various people. It was different each time we sat together. So. Okay, the goal is to increase the proportion of Medicare adults who were treated for depression from 22 to 24. That's a measurement that is in those goals. Of course, the idea would be to increase the number of persons who need care, receiving care for depression, anxiety, and as forth. How we want to do this is to develop a curriculum that's based on the train the trainer model. And what this is we look for and we make contact with key community leaders, church leaders, small organization leaders, Chamber of Commerce, different there, to hosting and to providing a person to go through the training where we would teach them how to teach a brief course that is related to mental health first aid, but it's an hour long instead of an 8-hour long course. So it doesn't replace mental health first aid. It's just to spread it out further with less of a time commitment. And then we would focus on some key indicators of mental health illness and mental health needs. And then the process of helping someone to get the help that they need. Where can you go? How can you approach that? And how can you be a supported person and do that and do it in a short time? And the train the trainer model is basically that the idea that we kind of create a ripple effect, that we send that person out prepared to train people in, say, their congregation, and that sends it, and then it keeps going further and further to spread it with relatively few resources to spread the information throughout the community. Crosswalk, it's a similar process to what we're doing with Stand, but they don't cross each other. This is really focusing on adults for adults. And the previous work is, of course, mental health first aid. This is just kind of an extension of that. And Prairie View will be taking the lead in this. I don't know if there are any questions.
Any questions pop up yet? Okay, not right now, Jody, but if they pop up, we'll let you know.
Okay, I don't know what more detail. Basically, what we're looking for is places that will host this and provide a trainer so that it doesn't continue to take resources from the county, that it becomes a self-living thing. And of course, Prairie View will provide support and continue training people, but it has a life of its own outside of, and create a better mental health awareness in our community and what resources we have.
Yes,
So,
sounds like a lot of the resiliency. We hear that word often, resiliency, and that trauma-informed communities. I feel like that is the avenue this goes, which is what we've been working
Yeah.
on for a while. So it'll just build up on that.
and just through the awareness, the more people who understand it, it reduces stigma. When you understand it on a deeper level, that takes the negative energy out of it, that you're understanding that it is a true medical issue.
Right. And again, looking at the target, we want it to go up. We want more people to be able to get treated for depression. They reduce that stigma, they'll come out and they will ask for assistance, right?
Yes.
All right. Great. All right,
Seeing any questions?
you see any? No?
No.
Okay. I'm going to stop the share because that is the plan. So everybody just take a deep breath because that was a lot of information. We will have that available for you, as I had mentioned, and we will have this recording available as well, because we know there were some people who were unable to make it. And wanted to remind you about this plan. So just like the plan that started July 1, 2020, much of that plan, I shouldn't say much, some of that plan got changed because of the times we were living in and the times we are living in. So know that this plan, here it is. We're going to get it out there. We're going to get it started, but there are always needs that come up every time we've done one of these over the 3 years that we might need to address. stronger, harder, different than what we actually put in the plan, but we will always go by what the needs of the community are telling us about health issues. So no, we have a plan, we have it on paper, but it doesn't mean that the whole thing is going to be achievable or that it might stay exactly as it is today, which is the 13th of June. So we already know we have some little errors that we're going to fix on those again. No matter how many times you read a document, there's always something. So wanted to just kind of get that out there again, that I appreciate all the work that everyone has given to the plan. So I think it's a pretty meaty and good plan, particularly looking at the Healthy People 2030 and keeping that in our goals. Any questions, any thoughts, any comments from folks today? All right. Not seeing any. Any other thoughts in the room? We're good? All right. We have appreciated, again, everyone's time and energy. The process is coming to a close for the creation of the plan. The report is almost done. We will have that out and ready very soon. And we will also ensure that all the libraries get at least one hard copy at least, so that they can share it with their community for those who maybe don't have internet access, because we will have it out there. So I think with that, we will close it up. We appreciate all the thank yous that are coming in. And Patrick, I just saw yours. I wish I really had that ocean theme behind me to get us ready for Sand Creek summer days. But, oh, there it is. Thank you, Patrick. I got to find myself a background like his. All right, everybody have a great afternoon and thanks for joining us, and tell others about our community health improvement plan that will all be starting on July 1st, 2023. All right, catch you later.